is Jakat Maitland Ebanks, and today I'll be validating for the procedure central line venous dressing change. First, I'm going to look at my physician's orders. I'm going to wash my hands, gather my supplies, and I'm going to enter the patient's room, and I'm going to identify the patient with the wristband and by asking his or her name, and I'm going to introduce myself and explain the procedure. And I'm going to explain that the patient during the procedure would need to wear a mask or turn their head away from the site as I'm doing the procedure. So now I'm going to raise the bed to working level. And I've already provided privacy. I'm just going to raise the patient up. So I'm going to wash my hands, and I'm going to just assess the site. And I'm looking for signs of irritation and inflammation. So I'm going to put on my gloves. I'm going to open my... Now this is a sterile central line kit. I've checked the expiration date to make sure that it's good. So now I'm going to just open it up. And for demonstration purposes, I'm just going to turn the head of the mannequin away. Now I would have assessed the patient's comfort level. The site for any irritation and infiltration. So I'm going to retrieve my mask from the kit. Provide support. Okay, so I'm going to remove my dressing, and I'm going to inspect the site for any redness, signs of inflammation and irritation. And the skin is intact, and there's no signs of drainage or inflammation or irritation. So now I'm going to prepare my sterile field. I have my gloves here. Now I've instructed the patient not to touch the site or the sterile supplies. My sterile gloves. take my core prep. This is my my sterile hand, I'm going to crack it. And for 30 seconds with friction, I'm going to scrub the area that's around and under the dressing. So I'm going to lift. I'm going to scrub for 30 seconds. So I'm going to go up the lumens, and so now my hand that I've touched is not sterile. So I'm going to transfer, drop, and with my sterile hand I'm going to go into the sterile field and retrieve my dressing. So I'm going to wait for the site to dry, and once it's dry we're going to apply our sterile central line dressing change. So as it dries, with my non-sterile hand, I'm going to remove the backing. And I'm going to make sure that the dressing is in the window. And I would have put a bio patch around the lumens of the central line, just to I'm going to make sure the lumens are seen. Okay, so I'm going to make sure that it's occluded to prevent contamination, and I'm going to there we go. Alright, so now I'm going to label. This label with my initial and the date, so that for the next dressing change we can know when it can be changed. So I've labeled it with my initials and the date, and I'm going to put it on the side, not blocking the window, so you can be able to see what's happening underneath. Okay, so now I'm going to make the patient comfortable. I'm going to remove my gloves, mask, return the bed to the lowest position. I'm going to make sure the patient's comfortable and leave the call bell within reach of the patient. I'm going to clean up my sterile supplies, discard, and I'm going to wash my hands, and I'm going to document my findings if there are any inflammation or irritation, and there wasn't, so I would document that and the procedure that I performed. And that concludes my validation of central venous line dressing change. Thank you.